My name is Peter Earl. I'm an OBGYN doctor at the Kilmarnock office of Virginia Women's Center. My family moved to Colorado when I was a young kid, so I've always considered Colorado to be my home, and it remains the home for my entire family. Went to college in Boulder, Colorado at the University of Colorado, and also in upstate New York. So I actually ended up getting 2 bachelor's degrees before I went to medical school in Denver at the University of Colorado. Residency was in Phoenix at Good Samaritan Regional Medical Center. And subsequent to that, I've been in practice in a whole bunch of different places, and I've been in Virginia for the last 25 years. My interest in women's health care was a little bit strange, how it came about. And the story, as briefly as I can put it, is in third year of medical school, medical students spend a certain amount of time in each of the major fields of medicine. So you spend time in pediatrics, psychiatry, general surgery, orthopedics, women's health care, internal medicine. So you spend a certain amount of time in each one of those major fields. And then towards the end of your third year, you choose which specialty you want to go into. And I had actually gone through my entire third year in all the different specialties and actually hated every single one of them for a variety of different reasons. And the only one that I had left to go through was OBGYN. So I actually called up my dad at that point and I said, "Dad, I don't know what to do. I've done everything and I hate them all. And I just don't want to do any of those things. And I've only got one rotation to do, and it's OBGYN, and I know that I'm not going to do that. So I think I may as well just go ahead and leave school and go do something else." And he actually said, "You know, you've put all the time and the effort and the work in getting through the first basically 3 years of medical school, which is the toughest. Go ahead and finish." I went to a small hospital in northern Colorado to do my OBGYN rotation. And honest to gosh, my very first day there, I was with a fellow who was my instructor, and I spent the morning in the office with him seeing patients. Wasn't very impressed. And then the afternoon, he had a patient in labor, and we had to go to the hospital. And I had never seen anything like a birth before. This lady was on the table, strapped up, ready to have this baby, and suddenly he turned around, pulled this baby out so fast that I was like, "What? I was like stunned by what had happened." And I spent the rest of the day trying to figure out what actually happened. And then the next day, spent the morning in the office, went to the hospital again that afternoon to deliver a baby. And we were both gowned up and scrubbed. And this was a lady who was having her 3rd or 4th baby, and everything was perfectly normal. And she was getting ready to deliver, and he looked up at me and pointed at the patient and said, "Go get that baby." And I said, "What?" And he said, "Go deliver the baby." And he knew exactly what he was doing. And so he and I both went and delivered the baby together. And that was that. I became an OBGYN doctor. One of the really neat things about being in an office and seeing patients is the ability to see patients as things evolve, their care evolves, or their pregnancy evolves. And as time goes by, you get to see how things go for them. Hopefully, if there's a problem you're dealing with, that the problem gets better. And over time, as you're in the community, it's wonderful seeing people over longer periods of time, especially after they've had babies and such, where you get to see the babies grow into children, and that's just a wonderful thing, especially when you get to see them out in the community. I've been an OBGYN hospitalist for almost 15 years, and my time doing that has been at Memorial Regional Hospital in Mechanicsville. And working there, I have come to know all the Virginia women's doctors who work at Mechanicsville office very well over those years, because I've been taking care of their patients for all those years. When it came time for me to stop being a hospitalist, I was not ready to just stop being a OBGYN doctor, but I didn't want to be doing hospitalist work anymore. And as I was talking with the providers from the group, they were telling me about maybe they might be interested in helping staff the Kilmarnock office, and that was a very, very easy choice to make because this is a group of people that I already know very well. It's like I've been working with them for 15 years already, even though I've not officially been in the group until just recently. So it's not like I'm joining a group that I don't know. I already know the group and have known them for a long time. And this is a group of providers that provide honestly the best quality OBGYN care to their patients of quite literally any group that I've ever been in all my years of practice. And the opportunity to join them and work with them was a very easy choice.